So, hi everyone. Thank you for being here today with us. My name is Dr. Rhonda Bryant. I am co-director of Forward Promise, a national program of the Robert Wood Johnson Foundation. And joining me today is Gina Womack, the executive director of Families and Friends of Louisiana's Incarcerated Children, also known as FLIC, based in New Orleans. FLIC is a grassroots, statewide, member-based, and intergenerational organization that's working to transform the systems that put children at risk of prison. FLIC is one of our newest grantees, and they're partnering with the justice system to improve services and outcomes for boys and young men of color. So, like many of you that are watching, our Forward Promise village of grantees, fellows, and national advisors have all kind of pivoted in this time of the COVID-19 crisis to address the pressing needs and the many issues that are coming to bear. So one of our focus areas is really on looking at the way that vulnerable communities and populations have been hardest hit by the crisis. And so we wanted to spend some time talking with our grantee organizations because they are the ones that are working to directly serve young people and their families. And we wanted to hear from them about how their work is being impacted, what are some of their greatest challenges, and what are some of their hopes coming out of this unfortunate ordeal. So Gina, thank you for being with me today, and thank you for being willing to share about what FLIC is working on in New Orleans and across the state of Louisiana.
Thank you so much for having me. We really appreciate this. At this time, it's really important that we really highlight the work of grassroots Black-led organizations who are on the ground, getting the work done, and a lot of times who are often, ignored up and until you actually need access to the families, and then we go back to business as usual. And as you said, FLIC, we're in Louisiana. We are in a state that has some of the worst outcomes for youth in all 50 states. We are consistently ranked at the bottom in education, poverty, and mortality rates. And within our work, we represent some of the most vulnerable communities of colors. Our families continue to deal with trauma. Interesting enough, I was actually about to start looking at how are our kids doing 15 years post-Katrina when the coronavirus hit. So, basically the threat of this virus is very destabilizing to our families. And you're going to add that to the economic crisis. Families are losing their jobs, they're struggling to pay rent. And on top of that, as if they needed something more. A lot of our families who we deal with through the juvenile system, they're at the fear of, for the safety of their young people. And we do education work. So, like, we have always had a lot going on.
Yeah. So how has this situation shifted the way that you're operating both internally with your staff and with the individuals and the families that you're serving?
Yeah. So luckily, or whatever, like FLIC has been working for a while remotely because after Katrina, rents are just through the roof. We had gentrification. We lost the place that we were working out of, and we ended up, renting a small space. So it wasn't large enough for the entire staff. And a lot of our work has been outreach anyway, focused. So it was fine that we had a little office space. So most of the time we're working remotely. However, even though we were advanced in being able to work remotely, that we're inundated with emails, we're inundated with requests. We actually had some transitions at the end of last year. So we were onboarding staff. And this has come and it's definitely has shaken us because lots of us have families that we're taking care of. I care for my elderly mother. That means that I'm have full-time care for her at this moment because I'm not letting anybody in or, and I'm not going out, right? My mom's 92. Our other staff has elderly parents. They have young kids. So our deputy director of finance, she has young kids that she's trying to homeschool. She's trying to do the work and she cares for her elderly mother. One of our other staff member has, mom has the virus. And so it's, and then another staff member, they have young kids. So we've definitely been impacted so much so that we're trying to work in a time where we're all overwhelmed, we're all stressed out with our own personal lives, and then we're working with the most vulnerable population. So we're hearing and we're constantly hearing stories of families who losing their jobs, young people who are home from school and they are not only bored, but they don't have access to digital, they're not prepared, which is really sad state that in the 21st century, public school systems don't actually have access to computers. All young people should have access to computers and the internet. And we're hearing from parents who haven't heard from their young people, who they are, locked behind bars. And we have desperately been sending out messages to the governor, to the juvenile chief public defenders, to free our kids. We are working with our national partners. We sent, and local partners, we sent the governor a letter with over 30 organizational signatures to start looking at ways to release young people. We have national experts that have said that, definitely young people who are locked in prison are unable to separate themselves and do the things that are necessary. And the virus has unfortunately come in the facilities from the outside, right? And unfortunately, Louisiana, we lead in incarceration. We're all on the downside on positive things like education and things for young people, but where it pertains to incarceration and the negative impacts, we're leading. And so unfortunately, we're also leading, and we represent, I think, more than half of the young people who across this country have been detected positive for the coronavirus. So families are, they're concerned, they're scared. And we've gone through a crisis before, like nothing like this, but we're 15 years out from Katrina. And so discouragingly, we were hoping that we had learned a lesson in knowing that if you needed to do stuff for the general population, you need to do the same thing for our families and loved ones that are on the inside, both adults as well as young people, right? And as soon as we needed to start, staying in place, what were some of the things that could have happened while the young people were inside, right? And unfortunately, the response or lack of response that we receive is the reason we are where we are now. Like so many people, young people have tested positive as well as workers. So we're not only concerned for our young people, but we're concerned for the staff because they're on the front line. And you're not hearing a lot about that. And they're having to go home to their families and their young people as well. And so we're just really saddened by the lack of response and leadership around this issue.
And it really speaks to one of the big things that we know happens in juvenile justice, where unfortunately our children of color are more likely to be incarcerated, whereas other children are more likely to get access to community interventions that allow them to stay home with their families while still receiving the intervention services that they need to help them get back on track. So had we been more mindful about that structural and systemic disproportionality in the first place, then we wouldn't have had as many kids incarcerated while we're dealing with this virus.
Exactly. And that's really been our argument. Sometimes I feel like the Lone Ranger and the crazy person in the room. Like, we passed juvenile justice reform in 2003. Part of that reform was all about community-based programs, like understanding what young people need, right? And providing those programs in the community. And the juvenile system was set up, since, in the beginning to actually only take children away from home as a last resort. But we continually don't have our young people continually don't have access to enough community-based alternative programs. I mean, FFLIC put together a 3-point platform that pretty much spoke to, for the last 20 years, we've spoken to families, and basically, our families are in poverty, and unless and until we look at eradicating poverty, right, our families can never be prepared for a crisis, not the coronavirus, not another Katrina, because all of those things cost money, right? And so if we are as leaders, and we're looking for our leaders of our free world and our states to be more thought-provoking about this issue, right? The governor here released the statistics on the coronavirus, and like he seemed to be surprised that it was impacting our Black community at an alarming rate. And so you're setting up a task force at this juncture. Like, we have task force that looks at poverty, and we have a Black men and boys, different kinds of task force, but we continually set up, I guess, think tanks, if you will, that are not as far thinking as we need to be, right? And these are things that we should be doing on the front end. We shouldn't wait for a crisis to illuminate, right, that the disparities and how we treat our Black and brown communities is we are still operating under a racist system. And we don't want to have those conversations. We want to call it something different. We want to dodge around it and say, try to use the nicer words. But every time we have a catastrophe, a crisis, we come to the same thing. People in poverty can't evacuate for hurricanes because we have no money, right? You cannot get the mental health because we don't have a system that's set up in a way that's going to be supportive. We have a racist system that looks at Black people, Black and brown people very differently. So you have all these health disparities. We know, and so when you release the report, it says 70% of the people who are dying from this virus in Louisiana are Black. Oh my God, let's set up a task force. No, let's look at those things, those root causes, right, that we've been talking about since the beginning of time. You can't have a racist system. You cannot have a system that does not value all people, all children, right? We have children in the 21st century that do not have laptops, right? So the private schools are the better funded schools, are the schools that are paid more attention to. They have been able to shift to digital, like, because they've been doing digital, right? But that's not happening in the poor communities. So here they bought computers, but now we have to distribute them into the communities. I was talking, we had a staff meeting right before this, and I was getting more information. Some in Shreveport, some of the families, okay, some of our staff and community members got together and got laptops for the kids. And then they go to log on to the service for the school and it's not working, right? Like, because the schools are not equipped at this point. We're still in like New Orleans trying to buy laptops and get them. We're a month into this pretty much, right? And so how are our kids supposed to be getting the educational opportunities that they need if they don't have what they need to be able to live in the 21st century? We don't have internet, or it's too expensive. And so these are not new issues. These are things that have been plaguing our community for a very long time. These are the things our families, FFLIC, has sat at tables and explained to them. We put together a 3-point platform. Our kids need, access to mental health services, because these are the, you can't keep arresting kids because they don't have access to mental health treatment. And our previous governor, Jindal, took away so many mental health beds. And so instead of using the data to actually make good decisions to solve these problems, we wait until a catastrophe. Everybody's up in arms. I've been inundated with speaking to media, but these are not issues that are new. We can't even get access to media unless and until they need actually, let's call, FFLIC. They have actual parents. But at this point, like, you know, we're fielding media calls. We're trying to have parents talk to media, but parents are weary, they're exhausted, they're scared. They can't always talk freely on behalf of their kids when they're under state control behind bars, you know, and we've been telling these stories for the last 20 years. And
Right.
I'm hoping that they stick and that we actually start working on the real root causes, and that is equitable, you know, equality and things like that. And for real, not just using it as a buzzword.
Right. So, Gina, as a grassroots organization that's on the front lines with families right now, what does your organization most need in order for you to be able to serve the young men that you're working with and their families?
Right. Thank you. Well, not only young men, young women as well.
Young women,
Yes,
yes.
we continually forget the girls who are locked in prison and they have various needs as well. So we do, I mean, our organization is built on dreaming, right? Like and trying to get our families to dream. Like we need additional general operating funds. We need funders to really understand that, you know, the grassroots folks, the Black-led organizations are the organizations that need the most, right? Not the least, not to have the expectation that we can do everything on a shoestring budget, because we definitely try to make that happen, but we need to be well resourced. We had to contract with a communications person. Like we can't afford to hire a person, but every grassroots organization needs a communications person. We need a policy person. You know, we need people, like we need a full gambit of a staff. Right now, FFLIC has 5 full-time staff people, but we're a statewide multi-generational organization. You know, when I talk to a family member, sometimes that can take me out. You know, like I need therapy after
Mhm.
talking to one, because and we need people to understand the multi issues. So I'm talking to a family, she is frantic, and folks are frantic because they're like, I haven't talked to my kids. Like we get 2 free phone calls in a week and some stamps, but I need to talk to my child on a regular daily basis, right? I need to know, I need to be able to see them. Like we haven't been able to set up ways for families to be able to see their children. Like, you know, I'm the only person here caring for my mom because I've been in the house. She's 92. You can't come from the outside. My sister is like freaking out because although she knows her sister is here caring for her mom, she can't see, you know. So I was like, you know, I let her in, you know, under the certain circumstances to come, because we need to be able to see our loved ones. We need to be able to look in their eyes and know that they're doing fine. And a phone call is good, but nothing beats the face to face. And I get that we can't go inside the prisons, but we should have it set up so our young people are able to be on calls with their families and have some visualization, so that we can lay eyes, because I might be talking to you and you may be saying some stuff because somebody might be looking over your shoulder, because not letting you tell the truth, but you might have a black eye, you might be beaten up, you know, I don't know what's happening. So we
Mhm.
need to be able to work and get all of those stories and have enough staffing that can understand what our families are going to and spend hours at a time on calls and hearing all the different issues and putting them together in a way that we're caring for our people as whole people. So I
Mhm.
can't just say like, okay, I'm sorry you're homeless. I just need to really hear the story about how your child is doing in the prison, right? And I need you to talk to the media and share your story. No, I need to be able to hear an entire story and then provide support for that whole person, so that if we're talking about self-determination and freedom, that they know that we're caring for their whole bodies, right, and their mind and their we may not be able to do everything for them, of course, but we can actually connect them with the various services. And we need people to be talking about this holistically, right? And if we also like long term or short term, you know, we need our donors and our funders to really understand that, especially if young people are returning home, they went into a system broken and they went into a broken system, right? We need to have services and mental health or just some healing mechanisms, which was really the thing that we were really excited about with the Ujima project that we got funding from for Robert Wood Johnson, right? Like, how can we celebrate the young person's return home? How can we connect them with people who are going to care for that person, him or her, and their families, and help, and not just judge, right? And so those are long-term and short-term solutions, but we need to be able to hire our members, our folks. We need to be able to provide them with love and support and trauma care, and train them while they're getting paid, right? And then help them go back into the society, either as folks that can help in the inside the system, sit at tables, so that they can share what the needs are and be able to go in groups, not just one person at the table. So you got 20 systems people, and then you have a FFLIC person or a parent, or, just saying, yeah, but, or if we can do this, and they go, yeah, okay. But then it never happens. We need our funders to really understand holistically, right? And be more informed. It always struck me when we would get funding from a funder knowing that we were anti-charter school privatization of schools, but then some of the funders were funding, folks that were pro-charter, like without having a full understanding of the spectrum and how intentionally or unintentionally something can undo the dreams that we really want, and so I just really having spaces that we are having collective conversations on real solutions,
Right.
and that only comes from having people at the table and also working with them. Because as I was saying to my staff, I was like, you got to have deeper conversations and help people dream, because like our families haven't had an opportunity to dream since ever, right?
Right.
Like, and it's unfortunate because families, people, mothers, fathers who, people who give birth to young people or babies, they all have hopes and dreams. No
Yeah.
one ever dreams that their child is going, or anticipates or look forward to their young person going to prison, or having to fight for a good school. You got to choose between a D or F school, or D or an F school in your community or outside of your community, right?
Right.
Like, those are just choices that make no sense.
Yeah. And I think that gets us back to really seeing the humanity of people and the humanity of families, and understanding that our Black families absolutely have the same hopes and dreams and wishes and desires for their kids. And we have to do better and do more to give them every opportunity to realize that dream.
Exactly.
And if we're doing anything less than that, then we're doing a disservice to not just our Black families, but we're doing a disservice to our entire nation.
Exactly.
So, Gina, I want to thank you so much for just sharing everything that you all are dealing with at FFLIC on the front lines. And, we're always here to be of
Yeah.
support and to help as much as we can to try to advance this agenda to get our young people freed and back home.
Yes.
So we're going to keep pushing, and we're going to keep pushing together.
Thank you. We really, really appreciate everything that Robert Wood Johnson is doing. I mean, especially looking at incarceration from a health perspective, because if we're going to get healthy and get whole, we can't rely on incarceration at every turn for our young people or our adults, right? Like, we need to really look at how we can move differently as a system and actually have multidisciplinary teams and services that work in our community for our Black and Brown people that, as you said, will support the entire, country, the entire world. As James Baldwin said, for these are all of our children, and we will profit by or pay for whatever they become.
Yes, absolutely. Thank you so much, Gina. I appreciate you again taking the time to share, and we will be continuing to keep in touch.
No problem. Thank you all, and stay blessed, stay safe.
Yes,
And we're praying for your family and all your loved ones.
thank you, and the same to you.
Thank you.
All right, bye.
Bye.